Welcome to this training session on the Stiletto Extended Dwell Catheter by Avia Vascular. The Stiletto is designed for short-term use, up to 28 days, allowing healthcare providers to sample blood or administer fluids through a peripheral catheter. This advanced device supports the use of a single-lumen, power-injectable catheter that can be easily inserted into peripheral veins. The Stiletto comes in two sizes: a 20-gauge catheter with lengths of 8 and 10 centimeters and an 18-gauge catheter with 10 and 12 centimeter lengths. It is suitable for power injection, allowing for precise administration while providing comfort and ease of use. Always consider the patient's anatomy and the appropriateness of the procedure when using this device. Avoid placing catheters in locations where the catheter will be kinked by patient movement. This may cause patient discomfort and/or patency issues. Identify a suitable vessel for access. Utilize direct visualization technologies, such as an ultrasound, when available. Put on personal protective equipment and clean the insertion site using the ANT, or aseptic, no-touch technique. First, remove the red locking clip. Then remove the protective needle cap. From there, ensure the lure or hub is secured tightly to where it connects to the handle. The Stiletto has a unique echogenic tip designed to improve ultrasound visualization of the needle tip and an ergonomic design compatible with different gripping techniques, allowing for easier, streamlined insertion. Once an adequate vessel has been identified through visualization, advance the needle until flash or ultrasound confirmation that the needle is in the vein. Clinician may continue to walk or advance the needle into the vessel following the needle tip with ultrasound visualization. Flick the index slide to advance the catheter tip into the vessel. Fully advance the thumb slide forward until you hear an audible click, indicating full advancement. This will engage the Sharps protection feature, allowing the hand to remain behind the needle tip. Twist the housing a half-turn counterclockwise to disconnect the Stiletto housing from the standard lure hub. While maintaining the position of the housing, slide the catheter over the sheath needle until the desired depth is reached. Withdraw the housing and sheath needle from the catheter. Discard the housing and sheath needle and immediately attach a primed extension set or injection cap according to institutional policy. Secure the catheter and place on occlusive dressing over the site in compliance with institutional policies. Be sure to closely monitor the dressing and overall condition of the site of the Stiletto Extended Dwell Catheter, especially within the first 24 hours of placement, and continuously monitor the location, dressing, and patency throughout use. Do not expose the Stiletto to acetone-based solutions to prevent deterioration of the device. Use a 10 milliliter syringe of saline to flush the catheter every 12 hours and after each use. If excessive resistance is felt, do not proceed with flush or infusion. Instead, consult and follow institutional policy for clearing occluded catheters. The Stiletto device is removed when clinically indicated. For example, unresolved complication, discontinuation of infusion therapy, or when no longer necessary for the plan of care, or after 28 days. Thank you for watching. For more information about the Stiletto, visit avia-vascular.com/stiletto.